So looking at pessary guidelines, there really aren't any. I know I can tell you my first pessary encounter, well, this was actually, I was an RN, and it just started in urology, came from the hospital, so really hadn't seen many prolapses.
This is recorded.
Oh, okay, thanks, sorry. It was just different from yesterday. So I went and the doctor went in, did an exam on the patient, came out and said, I need you to go in there and fit a pessary. And I was like, okay, I can do this, no problem. Never really encountered pessaries, didn't know what one was for what. I walk in the patient's room and take a look, introduce myself, all that good stuff. And I was like, oh my gosh, she's got an ulcer on this tissue. There is no way she's going to tolerate me touching this. So I go back out and I get the doctor. I was like, I don't know if she's going to really tolerate me touching this. Did you see that ulcer? And he's like, what ulcer? I said, well, I don't know. I just was like, I don't know what's happening, but let's go in there. So he grabs me and we run in the room. He lifts open the sheet, does not say a word, grabs me, walks back out. He's like, that's her cervix. It's like, well, I've never seen a cervix outside the body, right? So that was a good one. So anyway, unfortunately, we don't really have guidelines for pessary use. And it's kind of like, I ended up, after that, calling my rep and saying, hey, can we go over some of this real quick? So she came up. I lined up a couple of patients. We saw them together. So that was how I was trained on pessaries. So we all know they're not one size fits all either, or one style. When we're considering fitting a patient for a pessary, we want to take into, or even just like, well, they're coming in with us stress incontinence, prolapse. So what is their history? Are they a surgical candidate? If they're not, of course, pessary is a good option. What is their age? Are they still childbearing? Would they want to go, we really don't want to offer a patient who still wants to have baby surgery. Let's give them a pessary. If they're just run a lot and they leak, pessary is a great option for them until they're done having babies, although Bulkameds come out, so that's awesome. If they've had prior vaginal surgeries, what is their complaint? Is it incontinence also? That's where I find the biggest challenge is when they have the big prolapses and they also have incontinence, when you want to use the pessaries that really don't help with leakage. That's unfortunate for them, and then we still have to try to manage their leakage. And then are they going to manage it themselves, or are they going to come in the office? How far do they live? Can they make the trip? Do they require drivers? Are they going to be faithful with self-management? Also, that's huge. When we're talking about the vagina, you want to, of course, get the vaginal depth and the width when we're trying to decide on what pessary we want to use. What's the introitus look like? You're going to put a pessary in that's going to hold that prolapse nice, but it's going to fall out as soon as they stand up or have a bowel movement. What's their tissue look like? Do they need some treatment prior and then come back for the pessary fitting? Is there stress incontinence? And then what type of prolapse do they have? So sizing, this is kind of the standard. This is exactly how my rep taught me back many years ago, which you just use your 2 fingers and gently slide them in and open them up and kind of gauge on how much room you have in there internally. The introitus you can kind of see, feel where that pubic bone is in the patient, see if there's going to be enough room. Do they have good elasticity? I like to kind of push down on the rectum area just to see is there, that kind of helps me gauge if I can use a gear rung or not. So here's the internal exam, and then, take your fingers, decide on length, width, opening of the introitus, and then kind of gauge it against a pessary. This was taken from SUNA. The reps can supply you with pessary fitting kits, so if you don't stock pessaries, this might be a inexpensive way to have a kit that you can use. So you might want to get a hold of your rep. We use Cooper Surgical or Milex pessaries, but there's a couple different companies out there, Boutique or something like that, I think is another one that has the white ones. The pessary kits I always try to get for our residents that are over at the VA, just because I think it's helpful to them to have something to fit, so because they don't stock. Fortunately, we do stock, so I might go through multiple pessaries. There's manufacturer guidelines on how you clean these. We used to autoclave, and now we're not allowed to anymore just because of an institutional recommendation, but I think you can throw them in the autoclave, so it's easy to reuse them. But you know, the vagina's not sterile, so if you wash them real good in soap and water or throw them in the Sidex and soak, they're fine. They're silicone, so they're nothing we're allergic to, nothing the patient should have a reaction to, nothing that the Sidex should really break down. So this is the recommendation from the manufacturer also on what pessaries you use for what stage prolapse. I still will occasionally use, especially if the patient is going to self-manage, I feel like they're easier to remove, is the rings or the dish. If they have a grade 3 prolapse and the pessary fits nice and stays, if I can get that up behind the pubic bone. So I don't feel like this is exact. And I personally have my favorite pessaries, as you all probably do too. I'm not a huge fan of the cube. I don't feel like the patients are going to take it out every day, so I don't use that one very often unless I absolutely have to. And kind of the same thing with the donut. I just have a lot of trouble getting it out, or I've seen more vaginal infections. If I just need to fill that area, I can't use anything else. I'll use a donut if they're going to come back and I'm going to maintenance it. If they're going to maintenance it and they promise they'll take it out every night, I'll use a cube. But you know, sometimes they're not always. You got to test them, make sure they're trustworthy. So I'll have them come back sooner if they're going to self-manage, just to do a quick check. The inflatable is latex, so I'm not sure if you're familiar with that, but that one is latex. So if they have a latex allergy, they can't use that. And they will have that, they have to shove the tubing back up into their vagina, otherwise it's going to rub, and then find it to deflate it. So I think I've maybe used it one time. You know, and those are different sizes too. So, and you know, they're not cheap. So you might end up trying one, it might be too small, and then you got to order the second one. We just don't stock those. So just they're not used very often, and they end up, you know, just kind of deteriorating because they are latex. So I'm not a huge fan of those either. So here's a patient. Nice picture. So we got a 65-year-old female. She's got some difficult voiding. She complains of vaginal irritation and bulging. So what would you say her options are? Of course, she's only 65. If she's healthy, you know, she might want to go ahead and have surgery. You know, so that's always a talk. In these kind of patients, I do like to, let's just do a fitting. Let's fit a pessary, let's see how you respond. Because if I put her her cystocele back up and I give her support, is she going to leak? So if we are thinking about surgery, it's kind of nice to do a pessary for a couple weeks or a month and see how their symptoms are. Are they improved? Did it help? Did it make them feel better? Are they leaking now? Are they emptying better? All that. This is her urodynamics, and you don't have to get urodynamics, of course, but she was interested in surgery, so I did move her to urodynamics, and with the prolapse, she was in retention. She couldn't hardly void, and I believe we even had a renal ultrasound on her, and she had some hydro, so because of the bulging.